Good evening, everyone. I'm Dr. Joe from Boca, and it's my pleasure to welcome you back to the Dr. Joe Show. By way of background, I'm a psychologist here in sunny Boca Raton, Florida, where it has been my pleasure and my privilege to practice for the past 25 years. And at the 25-year mark of my career, I decided to launch this, the Dr. Joe Show, so that I would have a forum to share with you some extraordinary folks that I have met along the way. And I have two very special guests for you this evening. I was doing some reading the other day, and I came across a fascinating book called Shy Children, Phobic Adults. And I started doing some reading about just how much anxiety plays a part in our lives. And actually, anxiety is not always bad, and it gets a little bit complicated, but I have two special guests today that are going to talk with us about anxiety, about social anxiety, and about a very interesting topic called dating anxiety. So my first guest that I'll bring out in 1 second is a Dr. Barbara Winter. Dr. Winter is a psychologist here in South Florida where she enjoys an extremely busy practice. She has a number of areas of expertise. One is sex as a sexologist. The other is anxiety. And Dr. Winter is kind enough to join me today on the Dr. Joe Show so we can talk about anxiety, social anxiety, and then this topic of dating anxiety. So let me take a break for a sec and bring out Dr. Barbara Winter. Dr. Winter, it's such a pleasure to have you on the show.
Thanks for having me.
Thank you so much. I was telling the folks a little bit about your practice, and I also know that you're involved with a couple of special projects. You told me there's something going on with a reality internet television dating show, and I know you just did something with MTV. Are you allowed to tell us? Can you tell us a little bit about that?
Not at this time. I'm working on a couple of things, and I worked on something for True Life.
Okay.
And hopefully they're going to air it.
Okay, well, I hope so as well, but I knew that there were some special things going on. I was talking with our audience a little bit about anxiety, and I know that this is an absolute special part of your practice. What presents in your office? In fact, and actually, can you give us a little background about anxiety? Because there's so much in the press these days.
Okay, well, anxiety, everybody has anxiety.
We do.
We all have anxiety.
Okay.
And anxiety really starts from when we're born. We have to learn to master anxiety. I mean, infants have to learn how to delay gratification, how to not be impulsive. And as we go through life, we have all kinds of challenges, and we have to learn to master anxiety. The earlier we're successful at it, the easier it will be later on.
Now, I'm an infant. I'm lying on my back. My mom and dad's hopefully meeting most or all of my needs. How am I going to feel anxiety? I'm a little kid.
It depends on the stage. If you're an infant and your needs are being met, you're going to be fine, and that's what should happen.
Okay.
Now, you're a child psychologist. Do you know that there are three big things that big stressors that babies have
Okay.
that they have to master?
Are you asking me if I know this?
Do you know
Thank
what
you
they
for putting me on the spot. The answer is no, and so why don't you tell us about that? Thank you.
Well, babies have three big losses. Their
Okay.
bottles,
Mm-hmm.
their cribs, and their diapers.
Okay.
And at each of those stages, they really have to learn how to master the anxiety. Those are big losses for them. And most of them get through it unscathed, but some don't, depending on the environment and the circumstances.
Okay, so since I'm the middle child, can I now call my mother and ask about why my crib, I had to use my brother's crib or something like that?
Only if that created anxiety for you.
I don't think it really did. I don't think it really did.
Okay, and that brings up another point, because for a lot of us, there are certain situations where that for somebody might create anxiety, and for somebody else it might not create anxiety. A lot of it's how we label it and where we put it.
Okay, I was doing some readings about the difference between anxiety that we use appropriately, and then it becomes a problem.
Right.
How do we differentiate between those two aspects of anxiety?
Okay, well that's a good question, because there's things that we call eustress and distress, or
Okay.
psychologists call it challenge anxiety versus threat anxiety.
Okay.
And essentially, some of it has to do with how we label it. Obviously, there are big things that are big things. But eustress is anxiety that can be useful. I mean, I always tell my patients anxiety is like alcohol. In small doses, it can be very productive, and in large doses, it can be very destructive.
Okay.
So if you know, for example, that you're having 50 people to your house, and at 5 o'clock and it's 4 o'clock and you're just getting home and your house is a mess. That anxiety can mobilize you to clean up the house
Okay.
and can be effective.
Okay.
Now, if you label it differently and you collapse, it can be very destructive.
Okay.
So some of it is how we label it.
What sort of folks present in your office with anxiety?
Oh, all kinds of anxiety.
Like
I have people
what?
with generalized anxiety,
Okay.
people with social phobia. We're going to talk about that today, otherwise known as social anxiety, panic with and without agoraphobia, obsessive compulsive disorder. We all have anxiety.
Okay.
Now, when you ask me what kinds of people present with anxiety, the truth of the matter is everybody has anxiety. Now, for some people, that anxiety is going to be channeled into all kinds of other things and not present as anxiety per se, whether it's addictions or psychosomatic problems
Okay.
or family issues. It all sort of starts as anxiety. I mean, Freud said anxiety is a symptom of conflict. That's the medical model. So in order to
Okay.
really heal a lot of these things, we have to get to the original conflict.
Okay. Turn to social anxiety
Okay.
because it's all over the press.
Mm-hmm.
Can you tell our audience a little bit about what is meant by social anxiety?
Okay, well, social anxiety is typically more where you see somebody who has a real fear of rejection, humiliation, embarrassment in social situations. Then we live our life in social situations.
That is true.
So exposure to these kinds of situations can produce anxiety, and a lot of anxiety, which can overwhelm them, ultimately creating an avoidance pattern, which is really where the diagnosis is. When you see that avoidance of the stressors that create the anxiety.
Okay. A common example.
A common example is, well, the most popular, I think, is public speaking anxiety.
Really?
Yes, where people have to get up in front of other people and perform. It's a form of performance anxiety.
Is that similar to musicians and actors? Is that stage fright?
I would think so.
Okay.
But, stage fright, it sounds like when you say that is, quick and you get on and you do it.
Okay.
When you have real performance anxiety, ultimately you avoid.
Obviously, all your work is anonymous, but you did tell me that there are some very powerful businessmen and women who you would never know because, again, in talking, you told me that these are people who command huge respect, address hundreds, and you said thousands of people at a time. How can someone like that function with this social anxiety? It just doesn't seem to fit.
Well, first of all, one of the techniques, or one of the things that people may even use naturally, is acting to help overcome some of it.
Okay.
And so you see some people, I went online knowing that I was doing this, and I just took a quick look, and I saw people like Barbara Streisand they mentioned, Kim Basinger, and actually there's some stuff written about Ricky Williams.
From the Dolphins.
From the Dolphins.
That Ricky Williams, really?
That Ricky Williams. Now, I have two boys who are huge football fans. And Ricky Williams has been known to have some problems with pot abuse, which is documented, which is not uncommonly seen with people who have social anxiety.
Okay. Other well-known people as well? I mean, is that...
Well,
would we be surprised if we found out who has social anxiety?
Yes, probably.
Because they're hopefully getting
Right.
help and they're able to function.
They're getting help, or sometimes with a lot of psychological problems, you learn how to make your life work for you.
Okay.
And you put yourselves in situations that work for you.
Okay, so I'm thinking about anxiety as sort of a catch-all phrase. There's various parts. Dating anxiety.
Yes.
I've seen that all over YouTube, all
Yes.
over television. Is that something that you work with as well?
I do.
And what is that all about, dating anxiety?
Well, dating anxiety is a form of social anxiety where people have a fear of performing. They have a fear of being rejected. It's very hard for them to go out on dates, to behave on dates, to expose themselves to that situation. And sometimes they avoid it and they don't do it.
Now, is this in all ages? Is it young adults? Is it senior citizens? Can we all deal with this? Or do we all have this?
Well, do we all have social anxiety?
Or dating anxiety?
Well, no. Some people don't have anxiety in social
Okay.
situations. Or they
Okay.
have a little bit of anxiety in social situations. It becomes a problem when it becomes big and you start to work your life around avoiding the situation.
Okay, but if I'm a relatively smart guy and
Yeah.
I'm in a dating situation, what I'm hearing is I've got these two things going on.
Right.
I've got this sort of rational thing saying this is okay, I can talk, I can shake hands, I can drive a car, I can order off
Okay,
the
good.
menu.
That's all good.
But then there's this other side. I mean, it sounds like I'm playing worst case scenario
Right.
through the roof. Is
Right.
that thing that's going on inside of me?
Well, that can happen in very normal situations where there's some reluctance, but again, it's not overwhelming and it's not going to take over your life. Some of that is reality based,
Okay.
but for somebody with social anxiety, there's more going on like that.
Okay. My mom, as a former English teacher, is always correcting my language.
Uh-huh.
There's a word catastrophe.
Uh-huh.
I don't really know if catastrophize is a real word or we just sort of made that up. But it sounds like part of this dating anxiety
Mhm.
is I catastrophize, oh my goodness, this is not going to fly, or this is going to be horrible.
Right, or I'm going to be rejected, or somebody's not going to like me, or
Okay.
I'm going to do something that's going to embarrass me. I mean, there's all kinds of negative self-statements that have been conditioned usually for a very long time.
Okay. This is fascinating. I told the viewing audience that I have two special guests, and you were kind enough to introduce me to this young man who we're now going to bring on the show. Folks, I had not heard of this young man. Sometimes people accuse me of living in a cave, but when I went on YouTube and I saw what this young man had done, I said, oh my goodness, he's gotten tremendous press. In fact, I think our producer is going to try to show a short clip. So let's roll that, and then let's bring on Scott. So we'll take a
Okay.
short break, and we'll be right back. Thank you.
Sure has been a challenge trying to find my Miss Right. I've certainly tried all those dating sites with the goal of meeting my special girl. Here's my date line. I'm looking for a girl that I can call my Miss Right. 5'5", pretty, slender, and polite. Style, smart, sense of humor and fun. That's right. Could this be you? Are you the one? If you like to travel, it'll be a major plus. We can take a plane, car, train, or a bus. A girl who likes to exercise and stay in shape. We'll go to Whole Foods and buy organic grapes. I'll be protecting you like we were Edward and Bella. Take your shoes shopping, girl, make you feel like Cinderella. Whenever we meet, girl, you brighten my day. Especially through March, April, May. Hurricanes, dolphins, heat is where it's at. I'll take you to a game and wear my special hat. We can even just go stare at the sea, as long as you're the girl who likes me for me.
Welcome back to the Dr. Joe Show. It's my pleasure to have Dr. Barbara Winter, who's been with us today, and Mr. Scott Hyde. I am hopeful that the producer was able to show at least a short minute of that video clip. So Scott, in getting the ball rolling, can you tell our viewing audience a little bit about yourself and what you do? And then I'm going to ask you a whole bunch of questions about that video because it was just so fascinating.
Sure. Well, my name is Scott Hyde. I'm 26 years old and I'm from Boca Raton, Florida, and I work as a marketing consultant. And I graduated from Florida Atlantic University in Boca Raton, Florida as well.
Okay, now everyone is asking you the same question. I know you've answered it on a whole variety of shows. Where did the idea of trying to find dates, how did you get that going, and how did you come up with the idea to put it out there in the universe?
Well, basically it all started with my struggle with meeting women and online dating sites in particular. I was trying
Okay.
dating sites for several years, and I was able to get nowhere in terms of
Okay.
establishing a relationship, and I just came to the conclusion that it just wasn't going to work out for me.
Really?
So basically, as a result of my frustration, I just came up with this idea just to, why not create my own online dating video and put it
Okay.
out there on YouTube for the world to see, with the hope of finding my Miss Right.
And do you and do you have any sense of how many hits? Is that the correct word, hits? Or
Views or hits, yeah.
How many hits has that video received?
Well, right now on YouTube, it's received about 120,000 so far.
120,000.
Yeah.
Oh my goodness. It's a fascinating idea. And I appreciate your honesty, your openness, and to come on the show. Again, I'm very appreciative. You're a good-looking guy. You've got a career. You're well built. I met you for a few minutes. You seem like a very nice guy. Now I hear that you had some difficulty. I mean, were you having difficulty like Dr. Winter's talking about anxiety, dating anxiety? Is that an issue for you?
Yes, dating anxiety is a huge issue for me.
No way.
Yeah, I know it's like a contrast from my video.
Yes.
Basically, I just feel like really anxiety ridden in terms of approaching women and going out on dates, and it's really held me back because, I mean, in the video, I mean, I know deep down that I can be that person that's outgoing because the guy in the video would, you know, approach women and be very confident, and that's what I want to be, but I just been struggling for years. And I heard Dr. Winter talking about avoidance. I mean, I avoid those situations,
Okay.
and so I, you know, that's why I did the video, so I wouldn't have to like approach women on my own, and they would email me if they're interested.
They can just click on the computer. Well, ladies and gentlemen, you probably remember Dr. Winter putting me on the spot. Remember she asked me, do I know those 3 infant things? And as I looked very silly. Now watch this. Dr. Winter, we've got a few minutes left. Let's fix this.
Let's fix this.
If Scott was in your office, obviously not here on television, how would you start to approach this? Because look at this guy, he's got it all going on.
Yeah, well, can I just interject and
Please.
just throw out real quickly some of the treatments for social anxiety,
Yes.
which applies to dating anxiety. Medication is often used. There's different antidepressants, different anti-anxiety drugs, even beta blockers are used to manage some of the symptoms. And in Scott's case, he can maybe use that when he's on a date. I would never use something like that long term. And people who have
Okay.
significant anxiety do use medication long term, but the truth is, unless you get to the bottom line, it's not going to stay. But something like that on a date could help. Okay. There's also some of the things that we might work on is cognitive retraining, looking at some of the things in Scott's head. Like, what fills up your head, Scott, when you go on a date?
Well, just, you know, all the things that could go wrong, you know, whether I just say something stupid or I'm just, you know, afraid of humiliating myself or
Okay,
getting
but how
into-
do you know that that's even stupid?
I guess in my head I just there's really no reason for it.
Okay, so you think it's stupid, but how do you know the date thinks it's stupid? Isn't it more important that the date thinks it's okay?
Yes, definitely.
So you're blowing up a lot of stuff in your head that may or may not be.
Right. I have this tendency just to create all these scenarios in my head that could go wrong instead of just
Even before you get there.
Right, even
On your
before.
way to the restaurant, you are already imagining this is not going to work.
Right, exactly.
Okay, so one of the things that we work with is we would look at Scott's triggers, what he thinks about at the first step of the date, what comes up, what does his body feel like, what is he thinking, and as we go along in successor approximations, learning how to master some of those thoughts and changing some of them, which would obviously change what he feels like, and ultimately, hopefully, change what he feels about himself. So there's that cognitive process.
Okay.
We also use things from communication and persuasion research, more how to communicate, social skills training, things like that. Do you think that's something that could benefit?
Yeah, I mean, it's definitely worth a shot because I've just been struggling for years, you know, dealing with this social anxiety, dating anxiety, and, you know, nothing has improved. So, I mean, you know, and trying something new would definitely be worthwhile for me.
And Scott, how old are you now?
26.
Okay, so at what age do you think, looking back, that you started to, I mean, did you have any sort of anxiety before, like, dating came onto the picture?
Yeah, I actually did, well, during my teenage years, more just social anxiety because I was bullied a lot when I was younger, and it just really contributed to just being nervous around people, just thinking that they would start making fun of me or insulting me for no reason. So that really made me on edge and anxiety ridden, just speaking to new people in general.
Okay.
And it's been going on for many years now, and it's gotten a lot worse, and haven't had a chance to correct it in any way.
What I find fascinating is, Dr. Winter, you're talking about Ricky Williams, and I know there's other athletes and people on the world stage. If I wasn't sitting here talking with you and I had just watched that video, I would never have a way of knowing.
Right.
And I bet that's something that you see all the time.
Right. I mean, you're talking to Dr. Joe, and you seem fine to us. Good eye contact, good social skills. You seem comfortable. But it sounds like your anxiety is really more limited to the dating situation.
Yeah, I would definitely say so, because I just really just get so nervous and anxiety ridden when I'm, when I want to approach women that I'm interested in and go out on dates with, and I just get so flustered and for really no reason and no good reason, and I don't know how to deal with it, and I'm probably giving off a vibe of being nervous and just not confident, and that's probably also hurting my chances with the women that I've been out with as well.
Now I want to ask you both a question. One, as an expert on sex and anxiety and dating, and as a young man in the throes, I haven't been in a dating situation for a long time. Do you actually believe, you do actually believe that something horrible is going to happen?
Yeah, I mean, I really do. I just feel like
Okay.
just something, like I'm going to humiliate myself or just say something that's going to maybe offend the woman that I'm out with, or it's just like I just get so, or like I'm going to embarrass myself,
Okay.
and it really makes me very nervous. I mean, even just thinking about it right now, it's just,
Right. I can see you're anxious sitting next to you.
Yeah,
Just thinking
it's
You're
just-
picking up on his anxiety
Mhm.
just sitting next to him.
Mm-hmm.
Okay, Dr. Winter, what do you think of that video? I mean, you deal with this day in and day out. Do you like that as an idea, as a concept? Should we all start shooting videos?
Well, I think it's a great concept for dating,
Okay.
actually.
Because it's not. There's so many dating services. I don't want to name any of them in particular. But could you see this? In fact, take this and a whole new dating service.
Okay, on one level, I think it's great because you see the person, you hear the
Right,
person,
right.
you see them move, and you can learn more about them than just reading their profile.
Okay.
On the other hand, Scott's sort of talking about two different Scotts. The sort of anxious Scott, and then the Scott that's in the video, which he should do more of to learn how to be more like that. So there's a real conflict between sort of two parts of you.
So if Scott was going to be your patient, you could shoot or see yourself shooting a series of videos, just getting Scott, because you do seem very comfortable. And I know Dr. Winter did pick up a little anxiety as you talked about it, and I appreciate you sharing that. But you would start to approximate the dating situation by shooting more videos?
Well, that could be used. I mean, you can get very creative. The point is exposure,
Okay.
right?
All right, before we run out of time, you're now out in the universe. I'm not going to ask you how many women are now responding, but even at what's 10% of 126,000 or 1%, okay, now you get a response. Because now this woman has seen you, she's attracted, she's intrigued, something's going on, and she sends you an email, or I guess at your age, sends you a text. Are you still nervous?
well, when I receive the emails, I don't really get that nervous, to be honest.
Okay.
Because the emails have been very positive. I've received a
Okay.
lot of great feedback saying,
Okay.
from women that said that they either loved the video or thought it was hilarious, and
Okay.
so it's really been like positive reinforcement. So that's
Excellent.
a few people make some negative comments because when you put yourself out there,
You're
gonna
it's
get it.
happen.
Okay,
But
okay.
for the most part, it's been very positive, and from a lot of women, and that's what counts. So I know I did something right with the video at the very least.
Well, that is awesome, and we're about to run out of time. Scott, I want to thank you for coming on the Dr. Joe Show, and
Thanks,
I'm
Thank
wishing
you so much.
great luck, Dr. Winter. Thank you for
Thank
taking
you.
time out of your busy practice. In the time that I have left, ladies and gentlemen, next week I have an extremely special guest for you. I'm going to have on my show a Mr. Jay Ray. Jay is the president and CEO of Life Management Group Incorporated here in South Florida. He has received more accolades as a young businessman, entrepreneur, and social leader than I can shake a stick at. That sounded a little old-fashioned. And so again, we're going to bring Mr. Jay Ray on the show next week. Thank you to my guests, and
you.
thanks for
Thank you.
joining the Dr. Joe Show.